Hi everyone, Dr. Nemechek here. I want to talk about SIBO again, small intestinal bacterial overgrowth, and I want to share with you kind of a review of how most medical problems that you've ever heard of are now being linked to the inflammatory stress from SIBO. So just kind of a quick review. So what is SIBO? Again, small intestine bacterial overgrowth. Now this graphic you see here, this is somewhat kind of a normal representation of your intestinal tract and bacteria. So you have stomach, that flows into the small intestine, and that flows into the large intestine. Okay, this is normal. Now these birds represent these families of bacteria that tend to live up here, and the fish tend to represent the bacteria that commonly live down here. The ratio isn't well represented here. It's basically for every one bacteria in the small intestine, you have 100 million in the large intestine. And researchers will use the phrase almost sterile. So the small intestine is almost sterile, meaning no bacteria, very few, and yet we'll have 4 trillion bacteria in the large intestine. So we have to stay like that, and we've been that way for millions of years. Other mammals are this way, so that's kind of normal. Now, SIBO, S-I-B-O. SIBO is when you have bacteria from the colon, or as I call them, fish, living up with the birds. Okay, shouldn't be like that. This shows a lot of different types up there. Typically, it's 1, maybe 2 species that are up there. And now you're going to have 10,000 to 100,000 times the bacteria up there. And so this is where we get SIBO. So SI, small intestine, B, bacteria, O, overgrowth or excess. The small intestine is not built for this. And literally stuff starts leaking through the seams. And you get a massive inflammatory release. And the reason why the inflammatory release is so big, I'm going to show you. So if you do a cut here across the small intestine, you get something that looks like this. Now this isn't a human small intestine, this is a mouse small intestine. Ours is built the same except for these things we call villi in humans are very small. There's tons of them there, okay? But normally you have very few bacteria up there. And so the barrier nature gave us to prevent stuff from leaking in, it's only 1 cell thick. It didn't need to be much because remember, it shouldn't be almost sterile up there, okay? But if you have excess bacteria, now that overwhelms this little linear 1 cell barrier and stuff flows through, right here on the back side is 70% of the immune cells of the body. 70% of all the white blood cells that can generate inflammation are only 1 cell away from the inside. And we think, commonly people think, well, where's your white blood cells? Well, they're in the bloodstream. We measure them. That's only about 3% of the blood cells of the body are actually circulating. Okay, the rest are parked in the tissue, and they're going to react to anything that's not your tissue type, whether it's a fragment of a bacteria or a fragment of a banana. And then you get inflammation. Massive amounts of inflammation. So this is more than half your immune system potentially being triggered if you have SIBO with the fish living up with the birds. Now this recent review paper came out, and I'll have a link to this in the section below. Also, sign on to the YouTube channel so you can get all my videos. Look at all these conditions now. Look here, down here at the bottom. 12 groups of diseases related to SIBO. Here's all these intestinal things. Cirrhosis, fatty liver disease, Crohn's, also colitis. Here's heart failure, DVTs, heart disease, atherosclerosis. Probably strokes are included in there now. We got diabetes is in here, thyroid disease, kidney disease. Over here, pancreatic cancer, gastric cancer, rectal cancer, bunch of other cancers, depression, anxiety, autism. I've been talking about that for like 15 years now. Alzheimer's, Parkinson's, multiple sclerosis, typo there. You could add in here schizophrenia. This is most of everything you hear that people are sick with. And they're now saying you got to have SIBO to get these. Okay? So we need to be worried about SIBO. We need to reverse SIBO. We need to be focused on SIBO. All right? And the problem is the SIBO tests aren't very good, really. It's not very good. And so you have to treat for SIBO, and you can use a prebiotic fiber inulin, or you can use rifaximin. I'll talk about that. And if you feel better with those things, I mean, inulin and rifaximin are only going to fix SIBO. That's the only thing they do. And if you take those and you're like, hey, I feel better, guess what? You had SIBO. Okay? It's that simple. That's more accurate than doing a breath test or something. Okay? Now, our protocol has been focused on this for about 20 years. And so we're trying to lower inflammation overall so you don't develop these medical problems. We're trying to lower inflammation so you can reverse these problems, and you can reverse most of these. Like for hypertension, I routinely get people off 2 or 3 blood pressure medicines, usually within the course of a year. Okay? And this is what we do. We have to lower inflammation by balancing our omega fatty acids. And so you do that by supplementing with fish oil, which gives you omega-3s. They're the molecules that turn off inflammation. You supplement with olive oil. What's that do? That blocks the excess omega-6s in the food supply. That will drive it up. Then I put a just dose here every 1 or 2 years. This is meant for children who are growing. Then you have to reduce this intestinal permeability. That's leaky gut. Okay? Rifaximin works best in adults, but inulin, you can get a long way there if you can't get your hands on rifaximin. Okay? Kids, you start with inulin first. That's all they need. That's a plant fiber. Rifaximin is a special non-absorbable antibiotic, and it's sold in the U.S. under the brand name of Xifaxin, Xifaxin. It's awful expensive here, and it shouldn't be. Many people have to buy it through a Canadian mail order pharmacy, and they can get it very, very inexpensively. We've been adding now almost routinely in the practice glutamine to people to block a secondary form of leaky gut into the immune system that's being triggered by COVID. And most of the patients, especially if you get a little older, you're going to need some vagus nerve stimulation, and we have the vagus smart cable to do that. So this is how you can lower inflammation, okay? But the biggie here is the getting rid of the SIBO with inulin and rifaximin, and I'm recommending almost everybody start glutamine twice a day. Now in adults, it's 1 level tablespoon twice a day, and that's healing up the secondary form of leaky gut caused by COVID. So anyhow, look at this paper in the reference down below. You ought to print out this chart, stick it on the fridge, show it to your friends. Okay? People need to know what's happening. There's nothing to sell your primary care doctor yet that he can use, a single drug or some magic test or something that people will make a bunch of money on. And so it's just kind of sitting there. You've got to take this on yourself to keep yourself healthy. So that's all for today. And everybody, lower that inflammation, take care of yourself.